Good morning, sir.
Hello, good morning.
Good morning.
I'm just checking. Okay, thank you.
Hello, good morning.
Morning, sir. Yeah, for me, it's showing lock event, sir. If I click, sir.
Morning, everybody.
Good morning.
Good morning.
Good morning, everyone.
Good morning, Pooja ma'am.
Hi, good morning, Dr. Raka.
Good morning. Good morning, Suji sir.
Hi,
Good
good
Raka,
morning.
sir.
Good morning, everybody.
Good morning. Good morning, everybody. We will start in next 5 minutes. We are just
Sure.
waiting for next 5 minutes more. Good morning, Mintu ji.
Good morning, Dr. Baka.
Good morning. Just for all the participants, we will be starting in next few minutes. Just stay tuned. Good morning, ED sir. तो हमसे बोल रहे हैं उधर से कीजिए। Good morning, everybody. We are just waiting for Professor Santosh Kumar, sir. We will be starting soon. He had joined, but I think he had joined in the attendees list. रंजन जी, अगर संतोष सर ने ज्वाइन कर लिया तो उनको पैनलिस्ट में ले लीजिए, फिर स्टार्ट करते हैं। रंजन जी,
सर मैंने दोनों लिंक भेज दिया, पैनलिस्ट का लिंक भेज दिया सर को फिर से ज्वाइन करने के लिए, तो अभी तक तो ज्वाइन नहीं किया, एक बार कॉल कर लेते।
ईडी सर ने ज्वाइन कर लिया, तो ईडी सर अगर आप काइंडली अलाउ करें तो मीनवाइल वी शुड स्टार्ट। इट्स टाइम नाउ।
डॉक्टर संतोष से आप फोन पे पूछ लीजिए।
हाँ सर, फोन पे बात हो रही है। ही इज ट्राइंग टू ज्वाइन। Sir, I think Santosh has joined now. संतोष सर आप सुन रहे हैं?
I have joined since 10:15 only. I'm listening to all the conversation, but I have not been given power to unmute myself.
So actually you joined through attendees list, sir. Panelist list.
I had joined through that. Doesn't matter. Please go ahead.
Yeah. A very good morning to everyone, all the dignitaries here. Let me formally, with the permission of Executive Director NIDM and Professor Santosh Kumar, Project Director, start the program. This is a national conference on children in disasters and emergencies, understanding vulnerability, developing capacities, and promoting resilience. As all of us know that children are one of the most vulnerable groups when we are talking about any disasters or emergencies. And likewise, this center was established under the spacious supervisionary direction of Executive Director of NIDM under the guidance of Professor Santosh Kumar, the Project Director of CCDRR. And since the time, the center is excelling itself, and this is first of its kind of national conference organized by the center that is virtual. And we can see right now over 700 participants have joined us in this 3 days program. And now I would like to invite Professor Santosh Kumar sir to give the welcome address to the participants and all the dignitaries.
Good morning, Dr. Raka. All the distinguished partners and Executive Director General Manoj Kumar Bindal from NIDM and my own behalf, personal behalf, I extend my warm welcome to everyone, Save the Children, Mr. Ray, and also the CCDRR team, which includes Dr. Raka, Dr. Balu, and Mr. Ranjan. Indeed, this is a very momentous moment, which we say that how gradually we are growing. But the concerns why we are joining as a big way in terms of today's workshop, there is a lot of gap also which we see when it comes to the building resilience amongst the future generation. And that is that what we see when ourselves, when we revisit our own case. When we were growing in the 70s, I passed out from the school in 1978, and none of the school curriculum or anywhere we were talked about that how to fight out with the earthquake or the cyclone or the flooding. I graduated from Bihar, and Bihar is one of the most disaster-prone states in the country. And there also, while I was growing, when we moved to the college or university education, there also we did not get any opportunity which can talk about that building resilience. And if you encounter such kind of a challenges in future, and then you should do X, Y, or Z. But when we look at other countries where this kind of a disaster is happening, they are much ahead what we are doing now. So meaning thereby that I can say with this kind of, I'm not saying the grudges against the generations, our forefathers, but definitely their ignorance, I must quote, they did not take care of us well in terms of building resilience. And we are carrying the load of the risk what they created, and they did not look at the risk which we are carrying today. The same way our generation is to be said that we are also doing the same thing what our forefathers did. We did not take much interest in the building resilience amongst the children. Had it been there, we would have gone much ahead in terms of building resilience amongst the future generation. Especially when we talk about the disaster exposures of the country where we live. Our geophysical environment is such that even if we want to avoid, we can't avoid. Either we can get trapped into the fire, or we can get trapped into tsunami, or we can get trapped in the pandemic-like situation. So what we see, as I would say, that our imprisoned mind with the ideas of response, that we keep calculating the disaster management system accordingly. If you see then in 365 days, when disaster happens, only 10 days is dedicated to response for any disaster. But out of 365 days, you can take out 10 days out, Then 355 days is for the planning, for building resilience and all. But that is probably is not been addressed to. So that is why the future generation is again and again suffering. During our school days, we lost many friends also during the disaster time. Many of us who have joined, they also might have experienced the similar thing. So taking all these into consideration, and we looked into the situation that how 38 crores of population can be taken care of. Well, they are vulnerable. I was seeing this recent disaster which happened, because the tragedy of disaster management is that point of reference always becomes the latest disaster. Say today, when we talk about disaster management, we will be referring to Uttarakhand recent disasters, but the disaster happened in the past probably gets forgotten. So if you analyze the 10 disasters in the past and see the capacity gap, then probably we would be able to identify that what kind of a curriculum or what kind of a capacities to be built amongst the children to the youngsters and adolescents. So these are the things which we wanted to bring on the plate, and when we established a child-centric disaster management center, it's just not to have a center. As having a center could be a glamorous thing to encounter, but idea as to what kind of a changes it is creating, the impact. So that impact, our concern is that that is why we have joined hands with the partners who have been working in this area for long. Our journey for the especially child-centric disaster risk management, we are still a toddler. We have not been even got the 2 years or 2.5 years of age only. But our elder in terms of who are dealing with the child-centric DRR, like Save the Children, UNICEF, and this World Vision, and these are the organizations who are working. So we have joined hands with them, thinking that that how to we cannot address that 1.3 billion people, but especially we always say that our population is huge. So we thought let us focus on 38 crore population, which is the population is not that huge. So let us, we can bring the change here. We can also bring the change of that 1.3 crore people. 1.3 billion people. So that is what we think the children who are vulnerable, they do not, and that children definition, which always we keep seeing 0 to 5 years, or maybe 5 to 10 years and 10 to 15 years when go into adolescence. Those who are into it, they know it very well. So I'm not going to deliberate upon this. Just I wanted to flag these issues in the while welcoming all of you. This is very, very important initiatives. I take this opportunity to welcome all the distinguished panelists, resource persons. I see the list, national, international. So this is a very, very kind of a heartening to note that large number of this support which we have got from the panelists as well as the participants. So I, on behalf of the National Institute of Disaster Management, on behalf of all the participants, I extend my heartfelt welcome to all of you, to the resource persons and to the delegates who have joined this course. And I also welcome our Executive Director, Major General Manoj Kumar Bindal. So I would end here with the request to Executive Director, Major General Manoj Kumar Bindal, to kindly address the gathering by giving keynote address, that how he sees that the child-centric DRR or child-centric risk, I'm not saying DRR, child-centric risks to be tackled in the future, when we are actually waiting in 60 days is for, or 350 days is for mitigation and planning and risk reduction, and how the 10 gauge overpower of response in all the mitigation planning. I request Major General Manoj Kumar Bindal to kindly address the gathering, please, by giving the keynote address.
Thank you very much, sir. Thanks a lot for your welcoming remarks. Now let me introduce Major General Manoj Kumar Bindal, who is the Executive Director of National Institute of Disaster Management. He was commissioned into the Corps of Army Air Defense in December 1985. He is an alumnus of National Defense Academy, and Major General M.K. Bindal is a graduate of the Defense Services Staff College and has attended the prestigious Higher Command course at the Army War College, besides excelling in all other career courses in the Army. He holds a master's degree in Defense and Strategic Studies, as well as Masters of Philosophy in Defense and Management Studies. During his more than 3 decades of services, he has held important command and staff assignments. Major General Bindal served as the Provost Marshal in the United Nations mission in Mozambique, where he was deeply involved in the liquidation of the mission. He has been also the director of Center for United Nations Peacekeeping Force, New Delhi. For 3 years, he was also the secretary of International Association of Peacekeeping Training Center. Sir has provided us all the support in excelling the CCDRR Center, and most welcome, sir. You are most welcome with the keynote address. Thank you very much. Over to you, sir.
Thank you, Dr. Raka. First of all, Jai Hind. It's a great opportunity that we are meeting together today for 3 days conference on such an important topic. This particular center is the brainchild of NIDM and UNICEF together. It is supported by UNICEF, so I thank Mr. Tom White, India head, UNICEF, and Mr. Sarabjit Sahota, who has been deeply involved in setting up this center in NIDM, and Dr. Santosh Kumar, who's the project director, supported by Dr. Raka, Dr. Balu, and Mr. Ranjan. So this team has done a very tremendous job, and this center has grown from what it was to what it is today. That today we are having close to 1,000 participants, and the number is increasing, which itself shows how much it is valued, how much the programs of the center is valued. And I'm really thankful to the team for bringing up the center in such a good way. Today's topic, for the next 3 days, we are discussing on a very important topic, which is focusing on child-centered disaster risk reduction, disaster resilience, and how it can be brought up. Because this is generally not talked about much in any circles because of the various policy issues. The past decade has seen an increased focus within research and practice on placing children at the center of efforts to reduce disaster risk, including those risks associated with climate change. An increasing body of research demonstrates that children can and do play an active role in reducing disaster risks, and the benefits of involving children in disaster risk reduction, not just to the children themselves, but to the families, schools, and wider communities. Children are often perceived as passive or helpless victims in times of disasters, with limited potential to help safeguard themselves, their families, and communities against natural hazards, including those associated with climate change and other shocks and stresses. But COVID-19 has proved otherwise. Children were working shoulder to shoulder with their parents and with the other elders in the family to combat the strain of the COVID-19, which came down on each and every household due to the lockdown. So consequently, disaster risk reduction, including climate change adaptation, often excludes children. Instead, it focuses on top-down efforts targeted at adults, with the assumption that they are appropriate to the needs and priorities of the families, including the children and the young people. But the research shows that children can and do play an active role in reducing the risks. Evidence also demonstrates the benefits of involving children in the disaster risk reduction, not just to the families, but also to the wider community. The concept of child-centered disaster risk reduction, CCDRR, has been receiving increasing focus in literature and in practice of child-focused agencies as a term to encompass the values and commitment to involving children in DRR, including climate change adaptation. Children are acknowledged as actors whose perspectives, ideas, and knowledge, as well as their active efforts, contribute meaningfully before, during, and after the disasters, including those associated with climate change, both in DRR programming and beyond. So CCDRR takes a child-centered approach, drawing from the notion that when children are empowered and supported by adults, they can be better prepared to protect themselves and others, and also generate positive changes among the family and communities. So as CCDRR includes addressing risks associated with a range of hazards, including those linked to climate change. So it should also encompass research, policy, and practice. There's a long history of research on children and disasters dating back to the 1970s and recurring famines in different regions of the world. The disproportionate death toll among children in these events encourage the researchers to explore the causes of children's vulnerability. And evidence has also shown that children's limited access to resources and power within society makes them more vulnerable than most adults in dealing with natural hazards, including those associated with climate. And this data has been building up ever since. From 1990 onward, there is clear evidence to show where children are not being considered just as helpless victims of uneven and unfair societies. The evidences show that they can actually play a very active role in communicating risks, participating in decision-making process, taking action to prevent disasters. So involving children as active participants is increasingly being shown to present benefits to the children, families, communities, both in the present and the long term. Their unique ideas, perception of the environment, and understanding of risks have been highlighted time and again. They display creative initiatives and often spontaneously collaborate to prevent hazards, including those associated with climate risk, reduce disaster risk using their intrinsic capacities like their unique skills, knowledges, and resources. And it provides an opportunity for their perspectives and ideas to make valuable contributions to understanding the complex and context-specific factors that constitute disaster risk and designing and implementing DRR initiatives. Though through being involved in the children develop skills in negotiation, debate, cooperation, communication, compromise, and decision making. And they also develop a sense of self-efficacy and develop self-esteem from having their views and ideas acknowledged. Learning and participating in DRR at an early stage also helps to develop knowledge and awareness and skills in understanding and addressing the root causes of disasters in general. Such knowledge, awareness, and skills can go on to become an inherent part of their adult life. Thus, CCDRR can develop skilled and experienced citizens to face future disasters. CCDRR not only involves children, it involves adults, including parents, teachers, and government officials. Addressing the underlying causes of children's vulnerability, many of which are outside the children's everyday lives, requires adult initiatives and action. Further, while children can and should be supported in playing lead roles in disaster risk reduction, responsibility and accountability for preparedness, mitigation, and prevention, as well as response, lies with the adults. In upholding such responsibility, adults should acknowledge and advocate for children as actors with valuable contributions to create opportunities for meaningful participation that allows children to harness and build upon their capacities. In a nutshell, although children are at specific risk in disasters, much research supports the idea that they are not simply passive victims. Values-based and evidence-supported rationales for involving children as active participants within the disaster risk reduction are very strong and cannot be overstated. Children are motivated to learn about disasters to get involved in disaster risk reduction decision making and problem solving. They have the capacity to analyze and communicate risk, design and implement DRR initiatives, and mobilize their peers, families, schools, and communities. So, involving children as active participants in DRR not only ensures it is responsive to the needs and unique vulnerabilities, but is a means to enhance the capabilities of the children to deal with disasters now and as the future decision makers. So children's participation in DRR, both through CCDRR initiatives and through mainstreaming CCDRR within wider DRR planning and projects, also has widely acknowledged and supported knock-on benefits for families, schools, and wider communities. So with this, I will end my keynote, and I once again welcome all the participants. It has touched 1,000 just now, and all the esteemed panelists who are there, who will be speaking on this next 3 days. And I welcome them and thank them for taking out their time to address the children and other to bring about awareness on such an important issue. And I once again thank CCDRR team for organizing such a good conference. Thank you, and over to you, Dr. Raka.
Thank you very much, sir. Thanks a lot for a very in-depth keynote address addressing the vulnerability and how to develop capacities and how we will be helpful in promoting the resilience as well. Thank you very much, sir. Thanks a lot. We would request you to kindly be with us throughout the 3 days. So we will get a lot of initiatives also, your visionary directions and everything we will be getting, sir. Thank you very much once again. Now I would like to invite Mr. Sudarshan Suchi for the opening remarks of the conference. Let me introduce Sudarshan Suchi sir first. Sudarshan Suchi is CEO, Chief Executive Officer of Save the Children, and this entire program conference has been conducted in association with Save the Children actually. He is a seasoned civil society leader with 3 decades of local to global experience in academics, development, and corporate settings. And he's also having authentic participatory practices to empower communities to lead transformation. He is an alumnus of St. Stephen's College, prestigious St. Stephen's College of Delhi University, and Institute of Development Studies, Sussex, United Kingdom. Sri Sudarshan comes with the core competency of conceptualizing development programs, development-based business models, efficient resource mobilization, establishing partnership, collaboration, and coalition towards issues that impact children's fair access to basic human rights. He has worked with leading organizations like Reliance Foundations, Reliance Life Sciences, Institute of Rural Management, Anand, National Dairy Development Board, and prior to joining Save the Children, Sri Sudarshan was the Secretary General at SOS, Children's Village of India. He also brings in grassroots experience from his association with small NGOs like Society for Promotion of Wasteland Development. So, sir, most welcome for your opening remarks. Over to you.
Namaste. Thank you, everybody. First of all, Major General Pindal, Santosh Kumarji, Dr. Raka, and all others to give us this space to share our views. I'm always torn between pouring the heart out and punishing all of you with a lengthy speech, and also on the other side limiting myself to what needs to be talked about, and perhaps allow you to get on with what needs to be done even more than what needs to be talked. So let me say this, that whatever I'm saying today comes from my very active engagement in and involvement as a first responder in many of the disasters, and both man-made and environmental, starting from 1984 Delhi to the 2001 earthquake in Gujarat and Bhuj and Anjar, and then Uttarakhand, Kashmir, Kerala, wherever else. And so what I'm saying today comes resonating from what I experienced on ground. And I think somewhere every time what comes across is that the most vulnerable among the community get hit not just by the disaster but by all the uncertainties that prevail subsequent to the disaster. And while bulk of the responses take place in terms of relieving by way of material mitigation, the investment of time and energy which is needed in listening in people, their vulnerabilities, their state of mind, and you know what will help them cope up with in future, what's on top of their mind, is something that gets shortchanged. And today, when I speak this, when this entire context is child centric, I think we are sitting on a wonderful opportunity. And why is that an opportunity? Because I think not just COVID, but even otherwise, what I think, or rather, COVID has brought it even more evident to us that I think children can be trusted, can be depended on, and can be invested in. So, if we are talking about how would responses in future look like, or where would our investments and efforts go, I think it would go first in building capacities and resilience of children themselves, or building, in fact, their own understanding and comprehension. Because at the minute at which something strikes, it's almost like each person onto himself or herself. And that first reaction and response could go around defining what else would happen subsequently. And I also feel this because I believe that children today are far more receptive to and ready to adapt or learn context than perhaps as adults. A lot of our colors, prejudices, and these prevent us from absorbing all the knowledge that's available around us. So I think child-centric response system requires first of all to have faith, which is a tough call in a country like ours where predominantly, we tend to be patriarchal and feudal. I mean, today of all days we are talking, so it's wonderful that on the International Women's Day. So I think what all is it that we would let go of in trusting children and building their capacities? To what extent we are willing to, and then going beyond that, looking at the larger society in which the children exist during would call as what we call as normal times, which are hardly normal for the vulnerable children. So around these times, what investments we make, how do we build an attitude around children, for children and around children, an attitude in terms of respecting their spaces, in terms of what I would say as, I mean, they are the fifth space actually. So unless we redesign ourselves and reorient ourselves from exploring that fifth space and what all is potential there, I mean, put the initiative back there. So I think they are certainly not passive and helpless victims. They are very capable, and I say this by having brought up two children at home and engaging with a lot many more. And trust, you can depend, and you can hand over the baton to them. And I think in our planning process, in our, like I said, in our peace times, where how do we engage will define in emergency times how capable are people of responding. If every little decision making at all the time is controlled and moves upwards in organizations and institutions, and give back to children in the two spaces where they exist, the schools and the homes, if these are restrictive, controlled, and atmosphere, to expect children to come good during emergencies is very unlikely. I think let's unlock that potential. Let's respect their capacities. Let's start investing in children, and investing in children alone will not be adequate because it's us adults who have, the restrictions or the impositions or the conditionalities in our minds. So I think we need to lower the guard also, and from that, I think if we can have that entire turnaround of this child-centric disaster response to be child's as a primary stakeholder in it, I think we will make huge leaps and bounds. Second part is, I think we still somehow see the entire DRR context as an outside-in relationship. I think if we can turn it around to inside, outside, in, it would be much better. What is it that communities can do for themselves? Where is it there is fragility and where is it there are strengths, and identifying those and building on those strengths for communities so that it's an inside driven responsive. It just stops. And I think psychologically this is a relationship which helps in resilience, it helps in recovery. Importantly, it helps in maintaining a certain dignity and self-esteem while the response the machinery is responding. And it will also avoid a lot of duplicacy, which I have often seen huge amount of wastages that are caused in the enthusiasm of an outside-in approach around disasters. And if we could further leverage technology in terms of enabling children with technology, I think they would not only be the first responders, they would be the first information providers in terms of the context, the ground realities in do that, and we find methods of respecting, regarding, and valuing children, a core strength of disaster response system, rather than looking at them purely as somebody vulnerable and taking over or needing help or managing for them. I think that's where I'm hoping that our turnaround should come. If we continue thinking from a mindset of outside in and as a favor to, or as a even top-down relationship with children, I think we are shortchanging ourselves and we will miss this opportunity. And I really appreciate that UNICEF has come forward to set this up in shape of an IDM. I think there could be no better partner or this thing to bring in the spirit of and bring in the value from a children's perspective. So we at SAVE are full speed ahead, shouldering this responsibility along with all others who are gathered here. And I wouldn't hold you on much longer. Thank you again for this space. And I hope that the inside out process is what on the third day, at the end of the journey, we have to offer as our collective action for the community out there and the most vulnerable. So thank you, everybody. Thank you, Dr. Raka, for having given me this space.
Thank you very much, sir.
Thank you.
Lord, for this wonderful opening remarks of yours. And rightly you told that UNICEF has been a lot of value addition, and in fact they are our guidance for the CCDRR Center. And within a very short period of time, with the guidance of NIDM authorities and UNICEF professionals, we have achieved a lot, and but still a lot to achieve. So now I would like to invite Mr. Tom White, who is the Chief Emergency and Disaster Risk Reduction of UNICEF, for the introductory remarks. But first, a little bit introduction of Mr. Tom. Tom is presently the Chief Emergency and Disaster Risk Reduction UNICEF, and he is an experienced humanitarian with an academic background of mechanical engineering design and public health. He specializes in emergency preparedness, response, and DRR. He comes with more than 25 years of experience leading large teams and programs with international NGOs, UN, and the donors to respond to major international disasters. His experience includes frontline response during the acute phase of disasters, ranging from famine, disease outbreaks, including cholera, Ebola, anthrax, and meningitis, floods, hurricanes, cyclones, and conflict and civil strife as well. Tom also has experience working at the global level, managing a portfolio of country programs, as well as providing advisory support to an influential international donor. He has worked in 20 countries across Africa, Asia Pacific, Caribbean, and Europe. And one more thing I would like to add to Tom's profile, that Tom has been very helpful to this child-centric disaster risk reduction center, understanding the problems, promoting our team, and everywhere he's with us. So most welcome, Tom, on this platform. It's over to you now.
Thank you very much, Dr. Raka. And firstly, may I say just what an honor it is to be invited to share some introductory remarks for such a meeting, especially when I see such a star-studded cast across the board. So thank you very much. Also, it's quite a challenge to follow the remarks that have already been shared in such a short time this morning. So kudos to the speakers so far. I think, colleagues, I will sort of dive straight in and try to keep my time short, because I think while we can talk high-level stuff, I think much of the devil will be in the details, so to speak. I think, firstly, I'm very happy to hear some of the key points made already. I was particularly entertained and enthused by the 10 versus 355 days Professor Santosh shared, the 10 days on response versus 365 for resilience and preparedness and so on. That's really quite a key alarm bell that we should bring in our minds about how we should be spending our time and efforts to make our life easier, in fact, and more importantly, the lives of children and young people easier in the event of an actual catastrophe or response requirement. So I would say children, that's what it's all about, right? That's who it's all about. Children are consistently amongst the most vulnerable in any community, whether during peacetime, whether during cool, calm situations, in any context, anywhere around the world. Children are the most vulnerable population. There may be other vulnerable groups and individuals, but children are consistently at the heart of it. By the very definition, children are minors, children are dependents. They don't get to make their decisions. And that's maybe where we should be drawing our starting point in all of this. How can we bring children into more of a decision-making role? How can we involve them to try to reach the right decisions for them? Children are consistently amongst the most vulnerable. They're consistently the least visible. They're consistently the least heard. We don't get to hear their voices in these meetings, for example. If we scroll through the 1,002 participants, how many are children? Okay, perhaps not the best example, but it is one example of how we're always talking about their vulnerabilities and how to fix them. But when do we draw them to the table and listen to their concerns and invite them to share their ideas? They're the least heard. Do we actually involve children when we're inviting stakeholders to discuss where the vulnerabilities might lie and what the appropriate solutions might be to address those vulnerabilities? Often in the event of an actual disaster or catastrophe, the children in a regular situation, they may be dependent on their parents, on their caregivers, on their teachers, or other duty bearers in their community. But in the event of a disaster, all of those duty bearers, parents, carers, teachers, all of them will be equally worrying about a multitude of other issues. So particularly during the time of disaster, those children who are already amongst the most vulnerable suddenly lose much of the fabric of where they would consider their pillars of stability. So given the fact that the children are consistently amongst the most vulnerable, given that they are the least visible, how do we, and I consider myself talking to already much of, I think all of us are already somehow preaching to the converted here. We all somehow recognize much of the stuff that I'm saying, much of the stuff that has already been said by previous speakers. We all recognize these things. But what are we going to do to make a change? What are we going to do to make sure that all of this talk, all of these deliberations actually result in change for children? The CCDRR Center, the Child-Centric Disaster Risk Reduction Center, is really, it's come a long way in a short space of time. And admittedly, it's got a very long way to go too. But I'm so enthused by the way in which it is rallying to the cause. It is drawing these discussion groups and really carving a way to make sure that we are talking about the things that matter. I think where we need to be trying to drive is ensuring that the voice of the children is amplified, not just in a disaster situation, but before and during and after. It's those 355 days. What are we doing during those 355 days to ensure that we are capturing and properly hearing those voices of the children, and not just the children in our household or in the house next door, but the children in the hardest to reach areas, those areas that are most susceptible and vulnerable to climate shocks, or whether we're talking about floods or cyclones or conflict affected areas, even harder to reach. I would say we need to be making sure that not only are we hearing those voices, really understanding those concerns and vulnerability, but how are we also involving the children and young people, adolescents, youth? How are we involving them and inviting them to be part of the solution? And this is something that really is a challenge, and it may look different from one place to the next. So we need to be careful how we park everything in one pigeonhole. We need to really understand the specificity of certain vulnerabilities of communities. I would say much of what we're talking about here is about ensuring the voice and concerns of children and young people are captured. Considering sudden onset disasters, but equally considering perhaps less sudden onset. I think the COVID-19 pandemic is a good example of that. Perhaps it came in quite a sudden wave, but it's certainly here to stay for the foreseeable future. How do we continue to keep up with this ripple effect of the pandemic? It's not just about ensuring quality healthcare. Admittedly, that's a crucial point, and that point should never fade. But in parallel to that, when we have the healthcare, we also know that we've got major issues with sustaining quality services and access to those quality services. Particularly now, as we see a new spike in the number of cases in multiple states. How can we ensure that children, vulnerable groups, are able to continue to access quality services, whether it's healthcare or nutrition services, education? At one point, we had approximately 300 million children across India suffering due to a sudden shutdown of schools. Many of those without internet connectivity and so on. That's one example. Within UNICEF, we have what we call the CCCs, our core commitments for children in humanitarian action. And at the end of last year, at the end of 2020, there was a new iteration of the CCCs, core commitments for children. There was a new release of the core commitments. And I won't spend too much time talking about these, but I will say that for the first time, these core commitments, while many might look at it as a UNICEF document, it's actually being delivered now in a way in which it's equally accessible and applicable for partners beyond UNICEF, whether that's government partners, whether that's CSOs, INGOs, international organizations, national NGOs, or whether that's for the children themselves. It's a very interesting and encouraging new iteration of the CCCs. And I would encourage those who have not seen it to try to find time. I will be sharing a link for that today. I don't want to think the CCCs is they're essentially core commitments across multiple sectors, social services sectors, in a way in which help us to prepare for and respond to and recover from disasters, ensuring that the requirements and vulnerabilities of children are addressed across multiple sectors, whether through programs, whether through operations, and whether through policies, or whether through actual execution on the ground, getting our boots dirty. And just to say, it's nothing new as such, but it's taking international. It's essentially taking international policies, international frameworks, and producing those and basically tailoring those into child-friendly language in a way that can be really helped to deliver our programs and interventions from top down and bottom up. I like the way that Sudarshan was talking about the inside-out perspective. I think that's so crucial. How can we help children? How can we help young people? How can we help communities to help themselves? That's a really crucial point, and I would encourage that to be amongst our take-homes from the delivery. And amongst all of this, accountability to affected populations. That's a global term that's spoken about a lot, particularly in recent years since the humanitarian conference in 2015. And I think where we need to try to really narrow the focus, it's not just accountability to affected populations, but more importantly, accountability to affected children and young people. How can we really make sure what we are doing is appropriate for them? One of the best ways to ensure that is to ensure that there is a strong link with them, for them. And we're working with them, we're working for them, going forward to deliver for them. I think I'm not going to go on too much longer, but I would really say that I'm very happy to see such a broad spectrum of participants across here. I'm very happy to see the leadership of Save the Children with NIDM to bring this forum to the masses. I would really be very keen, I'm dropping in and out, but I'm going to be watching closely to really try to understand how will these discussions really result in meaningful change for children. I would throw a very provocative question to the masses and for all the speakers to consider, so what? We're doing an awful lot. We're very good at talking, and we are hugely influential in the way that we have resources, we have our networks, we have our programming frameworks, and so on. So what? How are we making sure that what we do results in meaningful change for children before, during, and after those jobs? Thank you. I'll leave it there.
Very much, Tom. Thanks a lot. Thank you very much, Mr. Tom. Thanks for a wonderful introductory remarks about the theme and the situation of children all around the world and how we have to work to achieve the DRR, actually, resilience and in terms of children. Now I would like to invite Sri P.C. Haldar sir. Sri P.C. Haldar sir will give you the special address about this conference. And before inviting him, let me introduce Sri P.C. Haldar sir. He had joined Indian Police Services in 1970s and was allocated Bihar cadre. During his entire career, he remained posted in Bihar, Madhya Pradesh, Delhi, and northeastern region of India. He joined the select band of officers earmarked for the Intelligence Bureau and served the IB over 3 decades before retiring in year 2008 as the Director Intelligence Bureau. He is also recipient of both Police Medal for Meritorious Services and President's Police Medal for Distinguished Services. He has, since 2009, served on several national level committees dealing with issues relating to national security. For example, Task Force for Security set up by Atomic Energy Commission, two-member committee to review functioning of the intelligence organizations, the task force for national security set up by the Union government. He was also a member of the National Security Advisory Board from 2011 to 2015 for 2 terms. He has vast experience of working in the conflict resolution. He was actively involved with the peace processes with the Naga groups in the 90s. He has been actively involved with conflict resolution in Northeastern region for over 2 decades and successfully bringing a number of militant organizations to the negotiation table. He was the Government of India representative for peace talk until 31st December 2016. Currently, he is heading Policy Perspectives Foundation, the think tank based in Delhi, who is also the knowledge partner in this conference. Under his guidance, PPF research team has completed a study on the status of cases under POCSO Act 2012 and dynamics of implementation, a report on Delhi, sanctioned by Delhi Commission of Protection of Child Rights. So, sir, for your special address, over to you, sir.
Thank you very much, Dr. Raka. One feels a little diffident after so many prominent and eminent speakers, particularly those who have a very long experience in the field of working for the children. My data may not show my long association with the children, but in the last 1 decade, we have been interacting with the issue of children in disaster and crisis situation. So we have gathered some this thing. We are still continuing in that same field as an organization. So I would share some things, but I must comment first the NIDM and CCDRR for organizing this conference, and it's very timely. The children are our assets and future citizens, and yet they also are very vulnerable segment of our social hierarchy. While in the recent last 2 years, thanks to efforts of all those who are working in the field of DRR, there has been a growing awareness and consciousness of child rights, and our responses to the calamities and disasters, natural disasters, have also increased tremendously, visibly. So I feel happy about that. And now that the focus has also shifted towards the child-centric disaster risk reduction, I'm doubly happy. As Dr. Raka mentioned, we did in our organization, Policy Perspectives Foundation, a study of Delhi NCR, a commissioned study by the Delhi Commission for Child Rights, Protection of Child Rights. We found that the legislative intent to protect the children are often frustrated due to persisting structural inadequacies, deep-rooted and age-old discriminatory social traditions, which deny both our women and children the freedom to express their views and problems. This is something our experience is that is happening also to an extent in the disaster management, particularly in the post-event era. I'm very happy that some of the speakers talked about the importance of risk reduction in the even after the event, that is beyond the event, because I find that while we are progressing and improving our response, which is 10 days, as very eloquently the I think Professor Santosh Kumar first brought it out, and the 355 days are left for preparation. But I think those 355 days should also be shared a little for creating a transition of vulnerable children who are usually affected due to psychological stress and various other emotional problems. What mechanism do we have? It certainly cannot be the responsibility of the disaster response force, but we need as a society a kind of transition which smoothly prepares the children for joining the main social stream after having gone through the horrific experience of a disaster. Disasters, for the matter, any violence, induces fragility in the environment of the children, and that tend to traumatize the lives of children and accentuate the criticality of providing or protecting children trapped in such a situation. Unfortunately, from the same experience that we saw in Delhi, we come to the conclusion that there are many well-intended, good protocols are in place, the acts are good, the procedures are laid down, but there is an apathy in visible or discernible in practice, wherein we tend to ignore the protection that the children deserve in such situations. So what we need to do is that, I mean, I hope that some part of the conference will be discussing this, that mentally and emotionally traumatized children in a disaster, with their different needs and modes of expressing their respective stress and emotions, how do we deal with them? Do we have a spatial cadre, or do we consider, therefore, there are specialized voluntary agencies which can do this? So can we integrate them formally into our disaster response schemes so that it is not left to those who have been asked to control the disaster, but to those who are emotionally drawn towards extending a helping hand to the children, which would be far more in number in the voluntary organizations. Another point is that the capacity to cope with immediate and life-threatening consequences do not exist in isolation for children. It is linked to the resilience and ability of the communities concerned. So in disaster situation, children suffer for the lack of support from the community. I mean, I'm not talking of parental love, but you need to understand the psychological trauma and also provide the necessary care for that. Because children often come out with deep scars, deep emotional scars, and psychologically held fears or notions. How do we really remove that? So this would require that part of the child disaster response should have a child-sensitive protocol. Now that child-sensitive protocol, if it is mechanically delivered to the children, it will have less impact than if it goes from a voluntary agency which has the long experience. So how do we integrate them in a very seamless manner, a smooth transition? I'm very glad that both Mr. Sudarshan Suchi and even the UNICEF gentleman talked of the situation beyond the disaster. And this is where we think that while we are doing quite a commendable progress in meeting with the disaster per se or in preparing for it, we are slightly, at this point, from my perception, need a greater attention also on the events beyond. How do you really release the vulnerable segments into the society to achieve their full potential once they join the thing? Because these traumas can affect both your reasoning capacity as well as how you socialize subsequently. So I do agree and support the idea of redesigning and reorienting some part of the post-disaster response, because merely having a legislative provision or protocol won't deliver that. It requires that touch, and that touch will come only if we bring in both the society as well as the formal government machinery together in a seamless continuum. And that's the challenge we have today. We perhaps need for that a broad overarching policy to consider within which how to tackle children in a visible. Okay, thank you. So this continuum is something which is very important. Well, my time is over, and I must thank Dr. Raka, who's been an old friend. And in fact, with him, we had done the earthquake disaster exercise drill in Noida Authority when he was also there. I thank once again the office bearers and the organizers from the NIDM and CCDRR, and thank them for giving me an opportunity to speak. Thank you.
Thank you very much, sir. Thank you very much, Haldar sir, for a very in-depth special address for achieving the goals of this webinar. And you rightly told that a long-term developmental, physical and both psychological setbacks during a disaster and emergency situation, and after that, is very, very important to look into when we are talking about developing capacities and resilience and understanding vulnerabilities. Preparing ahead of the time to meet children's unique needs at the time of disaster and emergencies is critical to their protection. And if we do not actually prioritize children's need, we will never be able to achieve sustainable development goals, Sendai framework for DRR, and Honorable Prime Minister's 10-point agenda on DRR. Hence, it is very essential to ensure that children are safe and secure, thrive and learn in both developmental and emergency scenarios. And every child, no matter who they are, where they come from, deserves safety, security, protection, relief, and care in times of crisis situation and beyond that as well. So along with that, thank you once again to all the dignitaries, and I would like to take the opportunity with all dignitaries to provide me with the vote of thanks to all of you. So first of all, I would like to thank Save the Children, who has been the collaborative agency in this entire 3 days conference, and the entire Save the Children team, all the speakers, all the workers working behind this. I extend my heartful thanks to Minto ji, Rubina ji, and all other dignitaries on this platform. And also I would like to thank all dignitaries today, Major General Manoj Kumar Bindal, Executive Director of NIDM, Mr. Sudarshan Suchi ji, Chief Executive Officer of Save the Children, Mr. Tom White, Chief Emergency and Disaster Risk Reduction UNICEF, Professor P.C. Haldar sir, former Director IB and President Policy Perspective Foundation. And also I would like to extend my heartfelt thanks to all the knowledge partners. Let me mention UNICEF, Child Rights and You, Handicap International, World Vision, YWCA of Delhi, and Policy Perspective Foundation has been our knowledge partner in this 3-day conference on children. And along with permission of all the dignitaries present here, if you kindly allow us, sir, we should move towards the context setting session. And I would like to invite our first speaker into the program. Thank you very much. Now we are moving towards our first session today, that is context setting session. And the first talk will be delivered by Professor Santosh Kumar, who is Head of Governance Inclusive Disaster Risk Reduction and is also a Project Director of Child-Centric Disaster Risk Reduction. The topic of context setting session will be the impact of disasters and emergencies on children, a multi-hazard contextual approach. But before inviting Professor Santosh Kumar, let me introduce himself. Uh, Professor Santosh is a disaster risk reduction, policy planning, and capacity development expert with 25 years of experience.
Dr. Raka, we can go ahead. Why to waste time?
Sir, there are a lot of participants, and it's important.
Okay. Please go ahead.
So, sir is always so humble that whenever I'm starting introducing himself, he stops me. But today, there are a lot of new participants and new partners also. So, sir, kindly allow me to go ahead. Sir is also a PhD in economics. He studied gender and development studies in IDS, Sussex, United Kingdom, and received professional training in disaster risk management from Israel. Backed with international work exposure at the World Bank and intergovernmental body of SAR, he has also worked at state level in different capacities in UP Academy of Administration, Nainital, and Rajasthan Institute of Public Administration, Jaipur. He is an experienced hand in designing, planning, and implementing mitigation and long-term disaster recovery plans and projects. Sir brings with him a rare combination of operations and academia. His experience of working at the grassroots to national to international level in all aspects spanning DRR is an added value. His specialization is in disaster management planning, post-disaster loss and need assessment, recovery, and inclusive disaster risk reduction is invaluable. Sir, along with that, I would also request that many requests we have received that during after the inaugural session and the speakers, if they are bilingual, that will be much more better. So, sir, now platform is yours. Sir, yeah, unmute कर लीजिए sir अपने आप.
I have done the unmute. Probably my voice is reaching or not?
अभी आ रही है.
Very good. So I will not say much today because many things have been told by all the distinguished speaker in the inaugural. Haldar Saab was speaking, then Tom White has spoken, and all Suchi Saab was there, and everyone spoke. General Bindal spoke and highlighted those issues. So it would be a repetition, but I would just flag a couple of issues. First of all, I would like to focus then when we are talking about building resilience of children, then first and foremost thing which we would be talking about their own exposure of risk and their vulnerabilities. So what are the tools available and what are the information which we have today with us, which we can see that where are the red spots in the country where we said that the children are into high risk area. So that has to be done on a quick short basis, because I said in the morning that if we can do not do anything about 131.3 billion people, then certainly we can do for the 30 crores individual, the future generation. So here we can focus on that our job, and then transition would always be there from childhood to adolescent and then to the adulthood. So, and this definition is also changing. Many of the studies done by New York universities and Princeton, Harvard, and they are saying that the girl child and the male child are differently, they are getting as a kind of the puberty is they are attaining at the age of 7 and age of 8. So this is a recent study. So how we can also relook at the definition of children.
सर साउंड आपका म्यूट हो गया, एक बार चेक कर लीजिए. संतोष सर, आपकी आवाज नहीं आ रही है. सर वी आर नॉट एबल टू हियर यू. एक बार म्यूट करके अनम्यूट कीजिए फिर अपने आप को.
So should I do anything else?
पता नहीं वीडियो हाँ एक बार लग रहा है सर लॉग आउट करके फिर लॉग इन करना पड़ेगा क्या? आवाज नहीं आ रही.
Yes, sir. But we are not sure whether sir could able to listen us or not.
I don't know he is able to listen us or not. Yeah.
Just I'll make it.
रंजन जी 995 के आसपास पे लॉक कर दिए क्योंकि फिर डिग्निटरीज इन नहीं कर पा रहे हैं. We are sorry for the inconvenience. It seems that Santosh sir has lost the network, but he can be seen in the list, but I don't know. Sir, एक बार log out करके फिर से log in करके देखिए. If you can hear us.
Ranjan, this is Sarabjit. If you can also allow me to log in from my laptop. Currently, I'm logged in from my phone, so I want to shift to my laptop.
Yes sir, आप लैपटॉप के थ्रू एक बार लॉग इन कीजिए क्योंकि अभी हमने रेस्ट्रिक्ट कर रखा है तो आप इजीली लॉग इन कर पाएंगे.
Okay.
रंजन जी एक बार संतोष सर से फोन पे बात कर लीजिएगा तो. मीनवाइल
बात कर लेता हूँ.
we are facing actually some technical problem from the speakers end. It will be sorted out soon. No need to be worried. We are into touch with the speaker over the phone.
I informed sir he may log out and log in. He was telling he is speaking continuously. But,
sir,
now you are audible.
Now you are audible, sir. Last 5 minutes, couldn't hear you. Last 5 minutes, yeah.
Okay, so I'll just, I don't know how much you have been able to listen to me, but I would be saying and not repeating much. Only thing I would say 2-3 things in terms of the position which we have talked about. I'm just talking about that here we need to concentrate on the the kind of population which we are referring to, the 30 crores. The second, which I referred in terms of that how the heterogeneity could be maintained, heterogeneity in our planning process, that in terms of the age group and also that sociocultural background of the children, cities and the rural and also the squatters, those who are living into that. So how those could be planned in terms and what are the tools which we are available with. And any disaster risk management planning, how children are getting involved into the risk management process. So how to plan for that and how that red spots and other things could be identified and could be there. And the third point, which I talked about, issues in terms of that world over, when the studies are coming now, when we talk about socio-cultural reality, the attaining age of puberty amongst the girl child is also changing. In African women, African children, we found that 7 years and others in 10 years. So how, whether that will go into the kind of planning when we talk about international definition, whether the international definition is also getting changed or not. The other thing which I would like to mention in terms of that what are the things which we can identify as help and hinder. So what is helping and what is hindering. So that could be identified for the disaster risk management planning system. Overall, when we look at the children's space for planning and children's space for their own voice, how that voice could be heard in that many different platforms, and how schools are actually planning to provide that platform, and the civil society groups. We have plenty of partners today, and all have been highlighting various issues with their experiences. So how that could be brought in terms of the disaster management planning. So these are the things, because since I have lost time so I will not encroach upon others' time, but 3 days I would be getting some opportunities in between, so I can get back to you. So Dr. Raka, I think I should stop here flagging these issues, starting from definition to population to heterogeneity, to their space, their voices, and their vulnerability, the kinds of tools, and the kind of resources. So if 6, 7 issues can be highlighted, it will help us in taking the plan into action. So that's what I wish to say here. And I would request all the panelists to kindly also focus. UNICEF has been champion in bringing those risk information, so we can start looking at those information and how we can further build upon. So thank you very much.
Thank you very much, sir. Thank you very much for very nicely setting up the context of the entire 3 days conference here. And certainly we would be able to do justice, I think, during the three days conference. And for the next topic, I would like to invite Mr. Sarabjit Singh Sahota ji, who will be talking about the next context setting session on the topic underlying risk factors for children. But before that, let me introduce Sarabjit Sahota. Sir is an architect and urban planner with over 25 years of professional experience working in frontline humanitarian and developmental agencies. He currently works with UNICEF as a disaster risk reduction specialist. He is experienced in steering development and humanitarian strategy, leading organizations, programs, and projects with frontline agencies in the domain of community, social development, humanitarian program management, capacity development, disaster risk reduction planning, urban planning, and design. So sir is an avid planner, disaster management planner, and a structural planner as well. So sir we would request sir to give us a structure for this 3 days conference, how we are going to actually search for what are the risk factors and what are actual underlying risk factors for the children, on which our speakers will be focusing on in these 3 days. So, Sarabjit Sahota, sir, over to you.
Thank you, Dr. Raka. I sent my presentation you and Balu, so just see if you can play it, because I cannot from my phone. So I've joined from my phone, but it'll be good if you can.
So, Dr. Balu, can you upload such presentation from your end? Ranjanji, if you can provide Balu the presenter's role. Sri Ranjanji, provide Dr. Balu presenter's role. Yeah, Dr. Balu, you are presenter now. Please upload Sarabjit's presentation.
And I will also switch off my video for protecting my network.
It's downloading. It is downloading. Just a minute, sir. I'll upload.
Okay, Dr.
So today, colleagues, first of all, great sort of congratulations to NIDM South Center, where our child-centered DRR center is led by Dr. Raka and others, Dr. Balu and Ranjan. They've been doing a great job there, and I think it's an with Save Children to organize this 3-day conference, and I'm really it's been heartening come and join you for a quick session on underlying risk factors. And I'll be following talking about the next slide and put it on the right. So where do you find use of cycle approach in particularly in the government systems? I think it's good to start that we're not life cycle approach is always within programming, particularly if you look at Census of India, where we have excellent disaggregate data information year on year, big information coming in. So that used flagship programs of Government of India are aligned to different age groups. For example, ICTS for children under 5, ICPS for I trust many of you would recognize these acronyms. So integrated child protections, adolescents, and so on and so forth. Within the disaster risk management policies and practices, do we see children as one monolithic or today? Am I audible, Dr. Raka?
Yes, sir.
Yes, sir. Perfectly
Okay.
audible. Go ahead, sir.
Yeah, I got some noise. I heard some noise. Okay. So today in my presentation, I will speak less and introduce you more to some of the tools. And the idea of my presentation is to share these tools with all the practitioners who are today on this course in very large number, to the extent that I could not even join the course. Which I wanted to share with you was is on life cycle approach for child-centered disaster risk reduction. So how do you plan disaster risk reduction along life cycle? Right? So this tool is here in this slide. I'm not going to open it. It's fairly sort of elaborate tool, but you can use it. It has a guidance note inside it. And the general logic which follows is that when disasters occur, they do not affect everyone in the same way. Certain people, for example, certain age group, certain gender, certain marginalized population are predisposed to be impacted more, or even getting killed, or and so on and so forth. So it's very important that we acknowledge that certain the hazards than the others. In different contexts, it'll change. In different caste, class, it might change. But by and large, there are disaggregations. But accepting this fact is very important for using this tool. In emergency planning, it is important to pay special attention to the needs of people and the vulnerabilities, particularly, because disaster risk reduction boils down to essentially about reducing vulnerabilities. So, which is about social vulnerability defined by the socio-political process. So we're talking about social processes for addressing the vulnerability. I'll move a little more detail into the life cycle itself. So how do you understand vulnerability and capacities along the life cycle? I would divide sort of childhood into 4 parts. or maybe 5. I'll go into a little more details, but here, just to start with, the first 1,000 days of life. That's the most sort of fragile part of the 9 months of pregnancy and subsequent couple of years of growth. And that's when you require a lot of time critical services. Right from the care and immunization for the mother to the labor room services for the. And I remember many years ago when with Save the Children, along with an developing the SARC, the first SARC roadmap for children. And that's when we came up with this term, which I saw for being used in this conference as well, that children can't wait. And children can't wait is the core sort of issue in this particular age group, the first 1,000 days. They just cannot wait. Even minutes might be too long in certain situations. Of health, wash, nutrition, care, so all that. Second part of the is what we categorize as under 5. In the first phase, first 1,000 days, immunization becomes one of the most important sort of inputs that we receive during a very short window of 1,000 days. And within this 1,000 days, we got to deliver the child survival needs, particularly immunization. And all of you who are on this course, I trust, are still getting benefits of what you got in, and that working along the life cycle approach. That if we get the right inputs within that window of opportunity, then we get the benefits for whole life. And the second phase of the life, which is under 5, is equally important. That's when the mental growth happens. A lot of our brain develops, and that's when you require all the micronutrients, macronutrients, and of course the related wash, health services. So childhood illnesses, particularly diarrheal diseases, become the big point of concern for undernutrition in this phase of life. Lack is often talked about, but that's less of an impact compared to the childhood illnesses, which more or less would have their origin in bad access or no access to safe drinking water, environmental sanitation, and so and improved hygiene. So that's the kind of problems that the second phase of life has, the under 5, what we call under 5. Then comes the middle part of childhood, and that's where children become more inquisitive. They want to know about everything, and that's when education comes in as an important response in response to their needs to know the world around them and engage with it. So participation in a small way becomes an important tool for enabling them to understand and those and I trust every one of you can understand that disasters become a significant impediment for continuity of some of these services, may it be education, nutrition, wash, health, or so. So continuity of services becomes an important issue and an important priority for us to plan along the life cycle. The next phase, which is before children graduate into adulthood, is adolescence, and adolescence is when the whole sort of capacity, real good capacity kicks in, and what was slowly transforming from vulnerability to capacity. Right? So children really start participating in decision making, and they take leadership on a number of issues. Of course, they still require health, education, protection services, and other kinds of vulnerabilities, gender-based violence, and those other forms of vulnerabilities kick in, and hence the protection becomes very important. So I guess you got a hang of it, and in the next slide we'll talk more about it. And as we go along these life cycles, different phases of the life, we got to understand the socially constructed barriers and bottlenecks to accessing the services, to accessing the benefits from different government schemes, or even within families, how gender discrimination might lead to differentiated access to resources. And from that point of view, Tom spoke about it earlier, and I'll just refer to you that core commitments to children in humanitarian action has been the sort of guiding document for us. It's a policy, it's a corporate policy for UNICEF on what kind of response do we need to engage with for children. Hence, what kind of preparedness do we need to take? Each sector has clear commitments and benchmarks for practices out in this document. Again, I've attached this document here in the slide. Just double click it and it'll open. And the core of this document, or the core of all the commitments which are outlined in this document, is child rights. So how do you ensure that child rights are respected even during periods of shocks and stresses or emergencies? And in this document, as well as currently within the entire UN system, we're following what we call linking humanitarian and development approach. So the disaster risk reduction, or the child-centered disaster risk reduction, is completely a responsibility of all the development systems. They got to be taking their roles and responsibilities and investing in preparedness, risk reduction, and prevention through the development means. And in the next slide, we'll discuss a little more. And finally, risk reduction requires coordinated, convergent, multi-sectoral action. And I think I can hardly overstate that no one sector is going to make that difference. All sectors, all society approach, all government approach is what we demand for, what children demand for. And we all know that in a middle income country such as India, things do go wrong. We do have such emergencies where services would break down, where certain children and families would be displaced for months together. And that's when the adaptive use of social protection services would be an important issue, particularly cash-based programming, or we're fortunate as a country. I think we have a number of social protection schemes which are delivered up to the last person in the village. And so programs such as PDS, public distribution system, would provide food, or Manrega would provide employment guarantee, and so on and so forth, and ICDS and others. So all these, I would consider ICDS as a social protection. I mean, I don't know if anyone would agree with that. And that's an important aspect, that how do we ensure that all these social protection schemes are shock responsive, means within the given context, within the risk profile of the state or the district, are the social protection systems able to deliver on their role and responsibility during the periods of shock and stress? Number one. Second, can social protection be invested in reducing risk? So that's the broad sort of agenda for child-centered DRR, and I trust you will follow this in this conference as well. And as you go, you will advocate for full recognition of children particularly in inclusion on all kinds of policies, including disaster risk management policies, climate change policies, and environmental policies, and so on and so forth. So that's my suggestion to all of you. I'm not going to go into the details, but I'm going to speak about this particular document. So this is just a screenshot of a poster or a handout, which is a one sort of document which lists all the government schemes linked to each phase of childhood, and below that you will find all the kind of description of the key points in terms of risk, vulnerability, need for response aligned to those life phases in this document. So please do use this document. Important point here is, and what you see here on the right hand side in the yellow column, is that each of these schemes of Government of India, we can assess them on these 6 parameters and what I call 6 factors of capacity. So do we have the leadership and coordination within those schemes to take stewardship, particularly for child-centered DRR and in that scheme? That's an important question for us to ask along these schemes. Are the human resources within these schemes trained on child-centered DRR? Important question. Do we have relevant supplies and equipments pre-positioned within these schemes to ensure that these schemes are able to respond to needs of children during emergencies? Do we have the finances and budgeting for that? And do we collect information on these schemes on damage and loss, particularly related to this particular life phase? And finally, do we ensure continuity of services during emergencies, and which is also about the resilience of these service delivery systems, that are these service delivery systems benchmarked to recover as quickly as possible during emergencies. So excellent document you have now with you, and these 6 questions, if you start assessing these schemes along this, I think this will be an excellent exercise for you to action on child-centered DRR. I'll not go into the summary, but this is the summary of my presentation. And Rakab, I've taken a little more than my allotted time, so I'm going to stop here. Over to you, and please do circulate my presentation to all the participants. Thank you.
Thank you very much, Sarji sir. Thanks a lot. Very wonderfully you explained through the life cycle approach, sectoral importance to understand that life cycle approach, and gender inclusive and responsive CCDRR is the need of the hour. Sir, actually, it was very wonderful, and certainly I'll circulate your presentation to all the participants here. Dr. Balu, you are requested to, after the webinar, today's webinar is over, we will circulate all the presentation to all the participants. Sure. And going with the next content setting topic, now with us is Sri Salman Jacob, who is from World Vision, and World Vision is also one of our knowledge partner in this 3 days conference. Salman Jacob is presently working as Head Climate Change and DRR at World Vision India, based at Delhi. He started his professional career as lecturer in environmental science at Shivaji University, and he then moved into the development sector and worked in different capacities as disaster management professional, environmental consultant, and climate change specialist in different organizations. He is currently involved in developmental programs at the grassroots across India on climate change mitigation, adaptation programs, and DRR interventions in communities with a special focus on children. Mr. Salman will be talking about the international experience, children's vulnerability and capacity, and actually where do we stand. Understanding the situation in the present context comparing to the world over is very, very important, and accordingly we have to match with the best practices actually. So over to you, Salman Jacob sir. Now, yeah.
Thank you, Dr. Raka. I have a small presentation. I'll just try to share the screen. Let me just take a minute to share the screen. Okay, is my screen visible now?
Yes, perfectly visible screen, and audio is quite clear, crystal clear. Go ahead.
All right. Thank you. So thank you, Dr. Raka, once again, and thank you, NIDM, the partners, for organizing this very important webinar and a very relevant topic, particularly in the context of children and vulnerabilities and capacities in the disaster context. As practitioners, we particularly working in the area of disaster management, we are all aware about the whole scenario of vulnerabilities of children to the whole aspect of disasters. And we know that globally, children are the among the most vulnerable, and we have statistics to give a clear indication of what is the level of vulnerability that the children are exposed to in various disasters, be it natural, man-made, like floods, cyclones, droughts, and various disasters. And it is not just limited to the trauma or the physical exposure that the child goes through in the event of the disaster, but it also goes beyond in terms of the psychological and the other developmental aspects, the educational deficits, and more than that in terms of the overall development of the child. And we also know that the Asia Pacific region is the most affected in terms of the natural disasters globally, which is home to 4 billion people, close to 60% of the global population, which means that the children residing in this region of the globe are even more vulnerable to the various aspects of disasters. And just to give an indication, we have got about 68 million people getting affected by disasters in 2019 alone, which is a very alarming figure. And equally, huge losses, economic losses, are incurred as a result of these various disasters, which in turn also affect the well-being of children globally. I would like to focus, as my topic is around the international perspective of children and their vulnerability. I would like to focus on this region of Asia Pacific, and particularly on a joint study which was conducted in this region, jointly by World Vision, Plan International, Save the Children, UNICEF, and national organizations, particularly in India, like EFICO, Child Fund. And the effort was to capture children and youth opinions and views on disasters and climate change. And this point was very emphatically mentioned by Tom White when he spoke as to how we can capture the views and opinions of children to engage them and to listen to them in this whole process of managing disasters. And as part of this effort, we were able to capture the opinions and views of children from 12 countries in the region, Bangladesh, Cambodia, China, India, Indonesia, Laos, Mongolia, Myanmar, and few other countries. And about 9,681 children and youth views were captured as part of this process. And this gives a representation of this regional issues around the vulnerabilities, around disasters, and their capacities to cope with. And it's interesting to note that 99% of the children and youth who responded reported experiencing disaster risks in the past 1 year. And among the disaster risks that they were experienced, they have experiences, more than 50% of them account to the hydrometeorological disasters. Just to give you an extract, a glimpse of what the children shared with us, I will take you through some graphs which are a representation of what the children are going through in this region. And we had done this exercise through online as well as face-to-face consultations with these children. About 33% of the contribution in these views captured were from India, and the children residing in different pockets in the country. And so this slide gives us that the disaster risk experienced in the last 12 months by children. Now, what are the disaster risks that the children have experienced in the past 1 year? And we see that the top 5 which the children mentioned are floods, droughts, air pollution, water pollution, and cyclones. Now, this gives us an indication of the kind of risk to which the children are getting exposed to in our region. And we all know that floods and droughts are a very, very relevant context, particularly to our country. And now we see the whole issue of air pollution arising to levels where everybody is now concerned about, and children are also getting vocal about this whole issue. We asked the children the question as to who in your community are the most at risk during disasters. And we see that the top 5, number 1 is the children and the young people. They themselves consider and they know that they are the most vulnerable. Secondly, the group of elders. Third, the people with physical disabilities. Fourth, the pregnant women, and then the homeless. So children themselves have an understanding that they are among the most vulnerable groups in the disaster context. And we did ask them as to are children and youth with disabilities provided enough support towards disaster preparedness? And looking at the response, we can see that there is a lot of work that has happened in this area, and 43% of the respondents have mentioned that yes, there is support that has been extended to empower the children with disabilities towards disaster preparedness. But at the same time, we do see that 45% of the respondents feel that no, it's not sufficient, that there is still a lot of room to work in this area of empowering the children and youth with disabilities in terms of disaster preparedness. So these are areas which are important as we look at the vulnerabilities of children. Then we asked them the question, have you noticed more climate change related disasters locally in the last 2 years? And we see an emphatic 78% of the children responding that yes, they have noticed these climate-related disasters occurring in their communities in the last 2 years, and which is an indication that they are very well aware of what is happening. And in terms of the what exactly are the effects that they are talking about in terms of the climate change related disasters or their experience in their own community. So the children mentioned that they are experiencing extreme temperatures, floods, more intense rains, decrease in economic opportunities, and of course exposure to cyclones. These are the children's views in terms of climate change related experience in their communities in the last 1 year. Again, gives us an indication of what our children in our communities are experiencing, what are the issues that they are going through, and what is the need that is to be addressed. And we pose them the question as to what concerns them most about their future. And the top 5 concerned areas for children as of now. Number 1, the top one is the whole climate crisis itself. They have rated it as the most critical issues they are concerned about as of now. Climate crisis. The second one is the concern about their employability, their access to work. The third one is the whole aspect of education, their access to education, because we all know that disaster context, recurring disasters lead to a lot of disruptions in the systems, and children are unable to access the education systems. The fourth one is the safety from the disaster impacts itself is something which is concerning them about their future. And the fifth one is about the access to basic needs in their household, in their families. So these are the 5 top things that the children in this region have highlighted about their concerns about their future. In terms of the awareness, in terms of the knowledge level on DRR and climate crisis, we found that 50% of the respondents perceived to know a lot about the climate crisis in DRR, whereas about 27% perceived to have an average or a medium level of knowledge in the area of climate crisis in DRR, and which is evident in a way that when we look around the global issues, the children and youth are becoming more and more vocal and concerned, and they are wanting to express themselves, express their concerns. So, we explored further as to where they learn about the issues of DRR and climate crisis. And we see that the top 3 to 4 points or areas, context from where they learn about it. Number 1 is the formal education itself. The formal education, the schools, from their textbooks, that is the first place where children mention that they learn about the whole issues of climate crisis and disasters and preparedness and all of those. The second is the media, the newspapers, the BBCs and the other news networks, the radios. That is where the second point of learning comes in. The third one is the social media, where we have Facebook, Twitter, and all the other WhatsApp and other technologies that are in the area of social media. Fourth is through the various entertainment platforms, be it movies, be it comics or cartoons and things like that. And the fifth one is through school clubs or other extracurricular activities, to summer camps and things like that. Again, this gives an indication of the maximum learning point. Like if we need to touch upon sensitizing the children or the youths, it is through the formal education systems or the print media or the news channels or medium. That is where the children are getting to learn about these issues that are relevant in their communities. Now, we posed the question in terms of what are their ideas? What do children think? What are their ideas for disaster resilient infrastructure that needs to be there in their communities? And this is what the children came up with. And the top 4 or 5 of them, the first one, the children idea is about having their home to be safe homes with child's friendly spaces and other aspects like enough water and food and things like that. So it's about their house that they want their infrastructure to be disaster resilient. The second point, the second idea in terms of infrastructure is about improved water supply and waste management facilities. Third one is around the whole aspect of strong construction of buildings. Maybe we talk about buildings, talk about building codes with storm and climate proofing aspects to be in place. The fourth one is about the retrofitting of school buildings and hospitals and other community buildings which they are accessing to. And the fifth one is about having evacuation centers or shelters. So these are the 5 core ideas that the children put forth in terms of having resilient infrastructure in their communities. We did ask about what are their recommendations to the national governments and other decision makers. And these are the kind of recommendations that the children came up with. The first one is to develop policies to protect environment. And these policies, a lot of them, they include the transportation sector, it includes the energy efficiency aspects, the water management, waste management. So all of these are the first priority which the children mentioned about developing the right policies towards environmental protection. The second one is to support and participate in the global action on climate change, the global issues, to be contributing towards the global efforts towards tackling the whole issue of climate change and its relevant and its associated issues. The third one is to allocate appropriate resources, funds, to prevent, mitigate aspects of climate change and to reduce disaster risk. These are the top 3 things that the children are recommending towards the decision makers. And we also have other aspects about strengthening the education system, allocating resources in order to disseminate the knowledge part, or disseminate the awareness on the whole aspect of climate change and disaster risk reduction to the masses, to the children all across, and the other points which you can also see on the screen. And we asked them, what is the best medium to connect, to engage with children? Good ways for the government or the other civil society or the NGOs collect their opinions and feedbacks on this particular issue. And we see that the children come up with various things. The top 3 are the children and youth forums. They would like to have engagement at the children and youth forum, have platforms where they are alone, they come together and they are able to engage and discuss with the government and other authorities. The second area is through DRR student clubs. The third one is to be represented in ministerial meetings and on platforms where there are high-level decisions to be taken, and children want to be represented there to share their views. And then the fourth one is on the high school and the university assignments based on DRR and things like that. These are the ways to connect which the children feel will be the most effective to get their views. Just to summarize, because this is an extract from the overall report which was released very recently, called as the Guardians of the Planet. And from these extracts, what I would like to say is, in conclusion, is children definitely in this region are extremely vulnerable, various disaster risks which were highlighted in the previous slides. The second one is the vulnerability and capacity issues need adequate attention. The points that we highlighted, be it the whole issue of empowering the children with disabilities, be it the whole aspect of appropriate infrastructure to be in place, or the whole aspect of sensitizing, knowledge sharing. So these are the areas that need adequate attention towards building resilience. The third one is on the inclusive platforms for children and youth to speak and to contribute in the whole decision-making process. The fourth one is, as we saw, that the education, the formal education system is where the children and youth get the maximum knowledge and sensitization in this particular area. So the DRRCCA formal education in school curriculum with improved access for disabled children and youth becomes a very important area to focus upon. And the last one is to empower children and youth to take actions to address climate crisis and disaster risk. This whole area of empowering them, and we know today globally, children are at the forefront in expressing their views and to highlight their concerns about the climate crisis and the associated disasters. And I think there is a need for them that we create space for them so that they are able to connect and engage, and we are able to work together, particularly in bringing about the whole resilience in this particular area. So these are the points which I thought I can share to all of you. Thank you.
Thank you very much, sir. Thank you very much, Mr. Sir. Actually, wonderfully you explained where we stand in terms of vulnerability, capacity, and resilience, and what actually we have to do, and all the other stakeholders should do if we want to achieve the children safe. And along with that, I would like to say that we are running a bit late from the scheduled time. So without taking much time, I would like to invite now Professor Pradeep Mathur, sir. Pradeep Mathur, sir, will be speaking to you in the first technical session about new education policy, promoting learning in a safe and secure environment. And Professor Mathur is a media person who took to the profession with firm belief that and conviction that media has to be viewed basically as an output in development in context of a developing country like India. First as a working journalist and editor for nearly 25 years, and then as a media educator for the next 22 years, he has actively tried to help focus on issues which will generate awareness and will be vital importance to society. The social consciousness took him from exciting field of political journalism in search of basic communication problems, strategies whose answers can lead to sensitize people about issues like environment, health, education, and cultural development. The quest keeps him going on. And sir is a veteran media person, and along with also a senior academician. Sir, most welcome on the topic. You have, sir, 12 minutes. And within 12 minutes, you have to finish up your talk. I'm sorry to say that, but we have to finish the conference well in time. Sir, over to you, sir. अपने आप को अनम्यूट कर लें सर, आपकी आवाज नहीं आ रही है.
Hello, good morning. Thank you, Dr. Raka. I must say.
हाँ, अभी आ रही है सर, अभी आपकी आवाज.
You are getting me now? I must first congratulate NIDM for this conference. Their concern for children in the disaster situations is really appreciable. I'm so glad. I mean, they have taken up this topic in a big way in the form of a national conference. Now, my view may look somewhat extremist, but I think children in poor and developing countries are always in a distress situation, disaster or no disaster. in the economy that is poor, children are the worst sufferers. The reason is that we do not, the basic reason is that we somehow do not like children and see them as an asset, but as a liability. And the reason for this is the bogey of overpopulation, which again is a result of underdevelopment. So, I mean, children we see as a burden, and unless the psyche changes, the social psyche changes of love for the children instead of seeing them as a liability, I think we cannot think in holistic terms about the development of children and all that. So first we must think that children are a great asset. They are the future of the nation and they are not a liability. And if there is overpopulation in the country, then it is not their fault. It is the fault of the rulers of the country, the government, because we are not doing good enough for development. And as we know, when you develop a society, then population comes within the manageable limits and all that. So I may sound a little harsh on the system, but the fact is that there is a need for an wholesale change of our attitude towards children. And only this thing will give us a greater sensitivity to look to their problems from an angle which is refreshing and healthy. Now, I am sorry to say that there is a little indifference towards children. We have not been trying to provide adequate funds for their development. And naturally, in a disaster situation, when everybody is in a vulnerable situation, all families are there, the children becomes the natural victim of this sort of a situation. Disasters are really responsible for making our fragile social security system for the poor and the downtrodden people even more vulnerable. And the result is that children coming from such families, they suffer the situation most. I'm so very glad that NIDM is thinking of how to help children in disaster situations, what sort of capabilities we have to build, what sort of emergencies we have to address ourselves and all that. But I mean, a holistic approach about the social conditions of the children coming from such families is very important. And only then we can perhaps take a broader and bigger view of how we can save them in disaster situations. Let us take the case of this recent corona pandemic. I did a study of the young students and young children, and for a media writing, which is my profession. And to my horror, I discovered that 70% of our children had absolutely no education during this period. The reason was very simple. The entire education was online, which required on digital devices, and 70% of children in rural as well as urban areas had absolutely no access to these digital devices. So poor children, 70% of them, I think there is a total figure, if I am not mistaken, was about 25 crores or so, could not get any education during this period when Corona put us behind our doors and all that. Now, this is a very big problem. I mean, I don't know how many people really thought of it. Not giving any semblance of any education to this big number of children is nothing short of a very big disaster and all that. Now, 30% of the students who are fortunate to have digital devices in their families in rural and urban areas, they also had problems in getting education. The reasons were infrastructure problems like poor connectivity, internet connectivity, power breakdowns, lack of facilities for repair and maintenance of these digital devices. These were the problems and all that. Now, beside this, our teachers were not trained into online training and education. So even those children who had access to digital devices could not get education. In many cases, children's classes had to be rescheduled for evenings. The reason was that they were supposed to be sharing digital devices with their parents. And since parents were using laptops, uh, uh, desktops, and mobiles in the daytime, children could not get access to them. So many classes of children were held in the evenings and all that. That was not a very convenient time for the teachers because they had their own things to do and all that. But this is, in brief, the point is that during this corona disaster, the children's education suffered the most. This was very unfortunate because that was the time children should have been told how to prepare themselves to face this problem. They should have been told the things like social distancing. In fact, it was an opportunity to make them health conscious. But we had to miss this opportunity because children could not be reached by any means and all that. Now, since time is short, I will not go into details and all that. I have a big plan about which I can think, the detailed paper which I will submit later on. But now, simple thing is that if we want to see that children do not become vulnerable in disasters and all that, we have to see that they do not become vulnerable, even normal situations also. We have to make them strong and all that. Only a strong man, or for that matter, a strong child can face a disaster situation strongly and all that. While issues like climate change may be bigger, but climate change is not an issue which is directed only towards children. That's a global issue for which things are to be done. Now, talking specifically of children, we have to see that children have to be given education, and education should be such as to make them strong enough to face disaster situations like floods, whatever it is, and all that. We know all what disaster situations are. The unfortunate fact is that we are not giving enough resources to education. In fact, education is a neglected sector, and in subsequent budgets, I think the total allocation, GDP allocation for education is coming down, which is a matter of great concern and all that. Fine, we have got an new education policy. I have been seeing it very closely and all that. It is many plus points, no doubt. But education policy doesn't ensure education for children. What ensures education for children are schools, good teachers, and also good care system in the schools. Only policy won't help them. Now, as we know, there's a lot of schools are private schools and all that, and children, large number of children, they cannot afford them. So unless we make a massive transfer of national resources into education, perhaps children's education, whatever policy we make, will not help and all that. Now, education policy is fine, but at the same time, schools should be such as to not only educate children, but to give them a basic minimum of security in the society. I think this midday meal scheme was a wonderful scheme. I hope it is being implemented very well and all that. That was something which will take very basic but very fundamental nutrition needs of children and all that. And I think, we can have schools as places where we can help giving a little better living standards to our children. There is no harm if we can provide free stationery to children in schools. I think we can also do something like giving them free tests and all that. After all, we are a country where there are people who have got money to be doing it. There is a massive effort can be done in that direction also. So schools should be, they can take a basic minimum of total care of children and all that. When we talk of building capacities and all that, I think we have to have faculty, we have to have pupil, we have to have social workers and all that who will look at this whole aspect of the holistic development of children and all that. We can also tell that in educational institutions, we can also teach them about how to face disaster situations, where they can even help their seniors and all that, their parents, their grandparents and all that. And so that the vulnerability or the loss in disaster situations is less and all that. Now, my simple point is that if we are to look to disaster situations and children's vulnerability in them, then we have to be preparing children even when there are no disasters and all that. And for that, a compulsory education system with a new education policy plus much more is necessary. And unless we are able to do this, perhaps we will keep talking big and all that, and we'll not be able to do anything substantial and all that. Since time is short, I would like to stop here. But if NIEDM is up and coming out with a publication and all that, I can write and specify all these things in detail and submit a paper to you. Thank you so much.
Thank you, sir. Thank you very much, Pradeep Mathur, sir. We would certainly looking forward for a paper from your side on this particular topic about new education policy, how it's promoting learning in a safe and secure environment, and what are the gaps where we have to fill in, actually. And rightly, you told that it's not only policy, but implementation is equally important on the ground. And without that, no policy matters anymore. So thank you very much, sir. And now time is really a constraint for me today because of technical difficulty. We have lost a few minutes. Now I would like to invite Sri Banku Bihari Sarkarji, who is the program officer in UNICEF and providing technical assistance to government of Bihar in policy and program formulation and its implementations. Dr. Baku has played a key role in the development of roadmap for disaster risk reduction 2015 to 30 with government of Bihar. He is also assisting government of Bihar in implementation of Chief Minister School Safety program covering all the government and private schools in the state, reaching out to approximately 30 million children. And Dr. Baku will be talking about the DM Act, National School Safety Policy, and other national and international commitments towards safety and security of children. Sri Bakuji, you will be having 12 to 15 minutes. Please stick to the timeline, please. Thank you. Over to you, Bakuji. Please unmute yourself.
हेलो
बापू जी अपने आप को अनम्यूट कर लीजिए क्योंकि आप now it's okay. Go ahead.
Okay, thank you, Dr. Raka. And I would like to thank NIDM and Save the Children for the 3 days national conference discussing the children and disasters. And I think it's a very pertinent topic. And previous actually speakers have already spoken a lot about the importance of this topic. And I expect that this conference will not actually limit itself to the discussion that we are having, because we see that children are the future generation who will actually suffer the most to the impact of disaster and climate change. Hence, I think this discussion should also actually lay a roadmap for the children to deal with emergencies and the climate change. So if we see why children actually we are talking about. So basically, if you see the percentage of share of children actually population across the globe. So globally, children actually account for 31%, whereas in India it's almost 37%. That is 164 million, which is half of the population, US population. And if particularly if I see in Bihar, children constitute almost half of the population of the Bihar, 46%. So I think if the children actually share a huge percentage of the total constitution of the population, so definitely their role is actually very important in the disaster management, as well as we see that in any of the disasters, if you see almost 30 to 40%, those who are actually impacted are women and children. And within that, if you see that children's vulnerability actually has already been talked about by our colleague from the World Vision, so I will not talk about it. So that's why it's very important for us to think about the children and how the different disasters and the climate change is really impacting children and their future. And my previous speaker spoke very good that during Corona we have seen how the children has actually been impacted, and we can see the number of days they have lost due to COVID, and still most of the schools are closed. And though we talk a lot that there has been a lot of digital content on education, but we also understand the digital divide, which is actually, there are millions of children who have not been actually able to really go to school or maybe continue their studies for almost a year. So as for the topic, I will actually talk about some of the policy instruments that is already existing, which really actually gives a lot of actually importance on talking about children and the disasters. One of the policy instrument that we should actually refer to is the UNCRC, which has been actually ratified by Government of India also, where it talks about that every children has the right to feel safe at home, at school, and in the community. That's a very important actually the commitment which has been there in the UNCRC. Then it also talks about every child has the right to live and learn in a safe, positive and balanced environment. So when we talk about any policy on the assignment for the children, so definitely we should keep in mind these two things, which is already written over there in the UNCRC. If we talk about the DM Act, though DM Act doesn't talk exclusively about the children, but definitely it talks about the promotion of safety awareness among stakeholders. It talks about the college, schools, teachers and students. But if you see the next policy instrument, that is a National Policy on Disaster Management 2009. I think it has come up a very robust actually explanation of how do we really talk about the children and engage them in disaster management, where it talks about the structural and the non-structural safety of the schools, which definitely caters to the needs of the children. It also talks about techno-legal regime, where it talks about the school building as a national priority. And I think that's a very important commitment which the Government of India has done as part of the National Policy on Disaster Management. Even it also talks about different kind of resident features that need to be part of the school building. And apart from that, it also talks about integrating or maybe bringing the reassessment into the curriculum. And after that, I think many of the boards have actually integrated lessons on the disaster management in the curriculum. Apart from that, it also talks about basically trainings of all the institutions in disaster management. So I think we should actually refer to the National Policy on Disaster Management 2009 whenever we really are developing any policy or plan on school safety or maybe for dealing with the children. And there is a very good actually requirement by Government of India, which has been actually, which is rarely talked about it actually, where we find the requirement of the Expenditure and Finance Committee. We call it a EFC by Ministry of Finance. It actually talks about that any government scheme, whether it's ongoing or new program, it needs approval. So it has to follow certain actually questions. It has to answer certain questions. Where it talks about costs involved in prevention and mitigation of disasters, it need to be included. Though we rarely find this is being actually followed. Wherever you talk about including this thing, so definitely they talk about the cost escalation and they really avoid it. Even it also talks about identifying the possible risk, where it talks about any risk which is actually supposed to be there in the geography where this development program is actually going to be implemented. Even it also talks about the mitigation measures for structural and non-structural actually nature, and which so that it doesn't create a new risk. And it also talks about that has the cost of disaster treatment or the mitigation measures being included in the overall project cost or not. So I think it's a very good guideline which has been issued by Government of India. But it's very unfortunate that this is really not being actually referred by doing any planning of any disaster actually programs in the state or at the national level. And then if we talk about the Right to Education Act of 2009, though it's obsolete because we have a National Education Policy for 2020, even that act also talked about the provision of safe school, all weather buildings, and even it talked about the safe construction. And then the SSA also came up with a whole school development plan concept, where it talked about the school built environment, where it talked about school safety and hazard resilience, even the environmental safety, sensitivity, and other things. So I think we don't have actually a dearth of any policy instruments. If we talk about the NEP, National Education Policy 2020, it has also a lot of actually ingredients you will find to make a school or an environment a safe and secure place. And then the National Policy for Children 2013, which again is not being looked by the professionals. I think it's a very important policy for children. We should actually definitely look at it, where it calls that every child has the right to life, survival, development, education, protection, and participation. Then it talks about the best interest of the child is a primary concern. And it also talks about a protective environment and safety and security of the child to be the integral of the well-being. So these are some of the things. Apart from that, we know that as Dr. Raka was saying, that we already have a very robust policy on national policy or guideline on school safety. which has been actually released in 2016 by NDMA, and which talks about the safe environment for children from home to home, where it actually focuses on not only capacity building, but also it talks about child-centered DRR education in the local context, mainstreaming risk and school safety in the education curriculum, and also talking about linking school safety in the existing government schemes and policies. So it's a very good policy which is being also implemented in several states. And I'm really happy that it is also being monitored by the Honorable Supreme Court, and MHRD, every state has to report quarterly to the MHRD, and MHRD actually reports back to the Supreme Court as well as shares with the NDMA. And NDMA is also actually really monitoring it very diligently, and also guiding states to really follow this and implement the school safety policy which has been developed by NDMA. Some of the points to sum up actually my presentation or way forward. We all know that children are actually, they constitute a generation that will be required to deal with the future impact of disaster and climate change. Therefore, it's very important that like this program which we are having, I'm really not seeing the participation of children. So I think it would have been good that when we are talking about, I'm seeing that there is almost 900 plus participants, but unfortunately I'm not able to see and the children whether they are participating. So it's very important that when we are discussing all these things about the children, so their participation is very important. Second thing is that we know that there are organizations who work on child rights, there are organizations who work on development sphere, and there are organizations who work on disaster management. So it's very important to bring all these communities together. So greater cooperation and collaboration is important. Then only we can actually will be able to divide the gap between the development and as well as the disaster. So they need not to work in silos, but they need to actually come together. Then one thing is very important. If definitely we would like to talk about the children in emergencies and disasters in true sense, we need to put children and young people in the front and center, so that they can actually safeguard the future of the generation of the children to come. Apart from that, we all know that in India we have a robust policy, instruments and commitment in place. And currently we are also seeing the funding is also not an issue, but the more and more emphasis should be given on implementation of a child-centered DRR program. And I'm really happy that at least NIDM has a child-centered child-centered DRR center in the South Campus. And I would request NIDM to really take lead and maybe come up with a national program on child-centered DRR. So thank you so much, and over to you, Raka.
Thank you very much, Sri Makuji. Wonderfully, you very in a nutshell, you talked about the policies, different type of policies and plans of the governmental, and what are the commitments towards safety and security of children. Thank you very much. Let me assure you that on our platform, at least 20 to 34% are children who are listening us. And in this 3 days conference also, there are 6 child champions who will be delivering their own experience firsthand in front of all the entire audience actually. And along with that, we are committed for the inclusive CCDRR actually, and we are not interested anymore into just we all adults have to sit together and talk about the children without inclusion of children, without hearing the voices of children. So I'm assuring you that that is there. And now the dear participants, this is our last presentation, and Manish Thakre will be giving a wonderful presentation to you. So just stay for next 15 minutes with us. And Manish is the head of program and policy at Save the Children India. And he is providing ongoing technical support to 12 state project offices to ensure quality implementation of urban programs. Manish is a master's and MPhil from Jawaharlal Nehru University in Applied Geography, and he is an external mentor to India Smart Cities Fellow, an initiative of Ministry of Housing and Urban Affairs, Government of India, on project monitoring of crimes against children in urban areas through data integration. Currently, he is also working on a collaborative research study with Climate Center of Cities on urban humanitarian response and planning, which is being supported by Save the Children India. So Manish has requested me not to take a lot of time. So sorry, Manish, I'm not giving you entire introduction. Over to you.
Thank you. Am I audible and my screen is visible?
Perfectly all right, Manish, go ahead.
Perfect. Thanks a lot and good afternoon, everyone. Namaskar.
Thanks to the organizer for giving me opportunity to present my views in this timely national conference amidst this COVID-19 pandemic that has disturbed the world and especially children from the most deprived and marginalized families. Since mornings, we have heard eminent speakers talk about the vulnerabilities of children due to increasing disasters and hazards. We also listened to various GUI initiatives on addressing the needs of children during emergencies, including the children's agency as an important role to play in reducing the risk. And the previous two speakers just before me focused on national level policies for safety and security of children. And I have been, as you can see on the screen, I have been asked to discuss on three important global agreements, that is Sustainable Development Goals, Sendai Framework for Disaster Risk Reduction, and Paris Agreement on Climate Change. That were adopted in the year 2015 and has important implication for children, climate, and disaster. As you can see in the diagram that all the three frameworks are critical for reducing vulnerability and enhancing resilience for all of us and including our own children. Before I briefly mention about the vulnerabilities of children across globe and South Asian subcontinent, I want to bring your attention to the recent quote from United Nations Secretary General Antonio Guterres while interacting with the young climate activist. Quote begins, "My generation has largely failed until now to preserve both justice in the world and to preserve the planet. It is your generation that must make us be accountable to make sure that we don't betray the future of humankind." Quote closed. As we have witnessed since last two to three decades, there is an increase in environmental degradation and rise in different types of pollution, and that has affected the climate. It has been evident in various research that climate change has caused increase or decrease in the intensity of rainfall, causing erratic floods and droughts in different parts of our Mother Earth. As you can see, different parts of the world are affected by flood occurrence. According to UN estimates, there are over 500 million children live in extremely high flood occurrence zones, while 340 million are in Indian subcontinent. Similarly, there are nearly 160 million children live in areas of high or extremely high drought severity and 27 million in Indian subcontinent. So how children to be protected in such extreme weather events or disasters? Children's rights are based on human rights, codified in the Covenants on Human Rights in 1966. The Convention on the CRC came into existence in 1989, exactly 70 years of the foundation of Save the Children by Eglinton Jebs in 1919 in London amidst First World War, where she first time talked about the rights of the children. As you can see in the slide, the white color font, this CRC also applies without any restrictions in emergency situations, such as disasters resulting from extreme natural events. The well-being of child enshrined in the general clause of the CRC is conceived as a guide to action, and it also has to be considered in all measures taken after a disaster. In the coming slides, I will be briefly discussing about the Sustainable Development Goals, Sendai Framework, climate change, and their interlinkages and implication on children. There are 25 targets related to disaster risk reduction in 10 of 17 Sustainable Development Goals. Sustainable Development Goal is a comprehensive development agenda, and it refers to Sendai Framework for Disaster Risk Reduction components, climate change, and knowledge and awareness about these frameworks, including sustainable urbanization. Targets on education focus on building skills and knowledge on sustainable development. It specifically mentioned improving or upgrading infrastructure for children's safe learning. It is important to note here that SDG 11 have 6 targets focusing on risk reduction. Now you will be surprised why urban is given such of a more importance. As we all know, over half of the world's population and half of the world's children live in cities. India will be 40% urbanized by 2030. And needless to say, the present COVID-19 is urban areas are the ground zero of the same. And children living in informal settlements are on the rise and are vulnerable to different types of hazards and disasters. A lot of cities across the world and in India with high population are located on floodplains and in storm-prone coastal areas. Considering the paucity of time, I will briefly mention 4 goals with targets that are important for children and risk reduction amid this pandemic, which has derailed the progress on a lot of SDG indicators. Target 3D, very important, on health focus on strengthening capacity for early warning, risk reduction and management of national and global health risk. Target 4.A, build and upgrade education facilities that are child sensitive and safe. And target 11.5, to reduce number of deaths and number of people affected and substantially decrease the direct economic losses caused by disasters. Target 11.B, substantially increase number of cities and human settlements, aligning their plans and policies to Sendai framework for disaster risk reduction and holistic disaster risk management at all levels. And in this particular slide, you can see there are 3 more SDGs. I'll be talking more on climate action because that is more pertinent to this particular event. Improve education and awareness raising and human and institutional capacity on child-centered mitigation, adaptation, impact reduction, and early warning. And 13.8 target talks about implementing the commitment to the UN framework on climate change. Now, briefly talking about Sendai framework for disaster risk reduction, which have 4 priorities of action that includes number 1 priority, policies and practices for disaster risk reduction. Number 2 priority, disaster risk governance at national, regional and global level for an effective and efficient management of disaster risk. And priority number 3, public and private investment in disaster risk reduction to enhance the economic, social, health and cultural resilience of persons and communities. And priority number 4, strengthen the disaster preparedness for response, recovery and rehabilitation and reconstruction to build better. And this particular slide, which is visible in front of you, these talk about 7 targets. Out of these 4 targets are focusing on reducing the mortality, reducing the affected number of people, reducing the economic losses, reducing the damage to critical infrastructure and disruption of basic services. And while 3 targets focuses on increasing the number of countries with national and local DRR strategies, international cooperation to developing countries, and lastly, availability and access to multi-hazard early warning systems and disaster risk information and assessments. In this particular slide, you can see that there are 7 targets of DRR are aligned to the 3 SDG goals and 4 targets for, for integrated monitoring. Now, there is another international agreement which I have been we have been asked to discuss here. Is the 3rd agreement on Paris Agreement on climate change. Is a multilateral agreement that is signed to reduce, mitigate greenhouse gas emission. This agreement commits to holding the increase in global temperature to well below 2 degrees centigrade above pre-industrial levels and to pursue effects to limit it to 1.5 degrees centigrade. And it also includes for the first time loss and damage from climate change as a standalone issue separate from adaptation. Now we will briefly look at how these agreements in 2030 agenda supports the right and capacities of the children in the context of DRR and CCA. So there are 7 important aspects. One is understanding the needs and capacities of the children, safe schools and education, child protection in crisis, children access to participation, information, redress and remedy, safe infrastructure and adapted services based on child-centered hazard risk assessment, reaching the most vulnerable children, and child-centered targets. As this session is focusing on understanding the vulnerabilities of children, I will now share with you what are the priorities for children and gaps under these agreements, especially with respect to point number 1, and also I will be briefly touching on education and protection aspect. So what are the priorities for children and gaps? Children are recognized as vulnerable groups, but there is limited discussion as on what makes them vulnerable. For example, unique exposure, sensitivities, or lack of capacities. Children as active agents are explicitly highlighted in nearly all the agreements. While there is a reference to Human Rights and Child Rights Convention in these agreements, in some critical instances, the language on rights or climate justice is weakened, reaching the most vulnerable. There is support for essential needs of the vulnerable population and to those who are furthest behind, and also recognize differential vulnerabilities among children. Under safe school and education, there is focus on school infrastructure to prevent damage and destruction, then on ensuring educational continuity in the aftermath of disaster. Like my previous speaker has mentioned, that how COVID-19 has affected the continuity of the education. And last is the child protection in disaster context do not appear in 2030 agenda. The agreements not mention key provisions such as commitments to include protection risk in disaster risk reduction and assessments and interventions, strengthening existing child protection system to prepare for and respond to disasters, promote safeguarding of birth registration and other forms of आइडेंटिफिकेशन। आपने देखा ही होगा कि जब माइग्रेंट क्राइसिस हुआ कोविड-19 के दौरान, तो कई बच्चों को जन्म दिया गया हाईवे के ऊपर। अब उन बच्चों का बर्थ रजिस्ट्रेशन कौन इंश्योर कराएगा? दैट इज द पॉइंट व्हिच इज वेरी इंपॉर्टेंट टू बी रिफ्लेक्टेड इन our instruments or agreements. And finally, I would like to share with you, this is my last slide, is about some of the ways for strengthening agency for children in DRR. So in the initial beginning of this event, Mr. Tom White says, so what? So yes, exactly the so what we are doing. We have all these instruments and so on and so forth. So what are we doing? So very important thing for us to understand that if we count, we care. Disaster management preparedness plan, climate action plans at the local level have to be informed by the number of children by age, gender, and disability, their vulnerable situation, and strategy to address their specific needs. Prioritize most deprived and the marginalized children, including the children in the special needs, for preparedness planning and actions. That is, again, aligning to the agenda of leave no one behind. And a third point is school curricula project to transfer knowledge on SDGs, Sendai framework, Paris Agreement, by leveraging these framework to promote information on climate and disaster risk to children. And next point is about action plan targeting children should be developed together with the children by supporting with adequate resources. And another thing which is very, very important in this context is monitoring and reporting of child-friendly campaign mechanism to be reviewed time to time and to be used in future planning and actions to improve on past experiences for safety and protection of children during emergencies. And another point is about strengthening existing child protection system with adequate resources and capacities that work during the crisis and after the crisis in the peacetime as well. And lastly, very, very important point for which we are also conducting a study in the Save the Children is need to have an actionable humanitarian response and planning with child-friendly lens supported by adequate resources. What does this mean? Preemptive and preventive actions to reduce loss of life, continuity of education, protection of children, to be informed by data modeling and institutionalization of good practices. Thank you very much for patience listening. Thank you, Mr. Raka.
Thank you very much, Manish. It was a wonderful presentation. You rightly make justice with the topic, identifying gaps and discussing SDG, SFDRR, and also Paris Agreement. And certainly we have to, as a child-centric professionals, child-centric DRR professionals, we have to look deeply into all these international commitments and policy as well. And wherever are the gaps, actually we have to fill it up. Thank you once again, Manish ji. Now I would like to request Sri Mintu Devnath ji, who is a manager at the Safe School with Save the Children and has been instrumental in organizing this conference to give a final vote of thanks for today and also tell participants about tomorrow program, module, schedule, and what all the things they have to take care of for getting successful participation certificate actually. And Dr. Balu, you can also help him out, Mintuji, regarding the procedures and protocols. Thank you very much. Mintuji, over to you.
Thank you very much, Dr. The children. I'd like to thank all this all the distinguished guests today. So, Major General Bindal, Executive Director at NIDM, Professor Santosh Kumar, Sushan Suchi, Save the Children CEO, Sri Tom White from UNICEF, PC Haldar, and also Sarabjit Shobha from UNICEF, and Salman Jacob from World Vision, and Professor Pradeep Mathur for this, and then Banku Bihari Sarkar, and lastly Sri Manish Thakre for giving this wonderful presentation today. And it was very enlightening session throughout the beginning till end. For all the participants, tomorrow is going to be an excitement for us. A very interesting topics tomorrow we have. So we'll be starting with the education and emergency, especially continuity of education during disaster and emergency for with this session. Then we will have the next session on the national policy guideline system for home to school, school to home approach. That is something is going to be very interesting. We do have the session on the child protection in disaster and emergency policy and practice. Very interesting, very focused to child protection in disaster. We will have on board 6 child champions across the country will be sharing their experience, their thoughts and recommendation to the forum in terms of what they think about the child-centric disaster risk reduction and education. We will have the session on the psychosocial support and well-being, special focus to the pandemics and the disaster situation, and lastly the interesting session on the understanding cybersecurity in terms of child protection in emergency and this digital era, which is very pertinent during this time. So I would like to invite all the participants again, and thanks for today's joining us. It was more than 1,000 plus participants across the country joining us, and it was a great learning together. And I request everyone to continue with us and for at least 80% attendance so that you can receive the certificate of this 3 days international conference. Thank you very much. Over to you, Dr. Kaka.
Dr. Balu, any words from you?
Yeah, please. An important announcement to all the participants regarding this certificate. I request all of you to keenly listen. It's an important announcement. I request all the candidates, please visit NIDM portal and register yourself. Make a one-time registration, and after that, the forthcoming events will be shown. So in that, click on enroll. You go to this particular program and click on enroll. So those who have registered with our portal only will be eligible to get the e-certificate. So our second criteria is you need to participate in all 3 days in this program with minimum 80% of attendance. Right. So we have given the link in the chat box also. Please visit NIDM portal and register yourself and enroll in this program. Till tomorrow night, you can register in this program. So after registration, after completion of this program, within 2 days of within next 2 days of completion of this program, you will be receiving a e-certificate, and the mail will come to you. And again, you have to visit our website and fill up your feedback. Then the certificate will be reach your mail. Thanks.
Thank you very much, Balu. Thank you very much, Mintuji. And along with that, all the dignitaries, many thanks for being with us throughout the program. And now kindly allow me to end today's session, and all the participants, many thanks to all of you for your love, support and interest in us. And we will be meeting tomorrow again. We will open the platform at 10:40 a.m. You may join thereafter. Thank you very much. Ranjani, now you